Hemophilia is a rare inherited bleeding disorder in which the blood does not clot normally. Hemophiliacs do not bleed more extensively or even more quickly than other people, but they do bleed for a longer time after an injury or surgery. Bleeding may occur internally, especially in the knees, ankles, elbows, and into tissues and muscles. If left untreated, internal bleeding into joints and muscles will cause agonizing pain and severe crippling. It can be fatal when bleeding occurs in a vital organ like the brain.
Essentially, the hemophiliac's blood has little to none of a specific protein that is necessary for normal clotting. There are two types of hemophilia, A and B. People who have hemophilia A lack a protein called factor VIII, while people with hemophilia B are missing or have low levels of clotting factor IX. About 90% of hemophiliacs suffer from type A. While hemophilia affects people of all races around the world, the most severe forms of this disease affect men only, as the disease is caused by a problem in one of the genes on the X chromosome. Female hemophilia occurs when either of the X chromosomes are affected or one is missing or inactive and they become carriers.
Hemophilia A and B are divided into three classifications. For people with severe hemophilia, they have less than 1% of the normal level of protein in their blood. In fact, they can have hemorrhages several times a month without any preventative treatment. Sometimes there is not even an apparent cause for the bleeding. People with moderate hemophilia bleed less often. Minor trauma is usually the cause. People who have mild hemophilia have even fewer hemorrhages.
The basic treatment to stop or prevent the bleeding in people with hemophilia is factor replacement therapy. This involves infusing either factor VIII or IX into the bloodstream to prevent or control bleeding. There are two main types of clotting factor concentrates. They are plasma-derived factor VIII and IX, and genetically engineered factor VIII and IX. Treatment for hemophilia depends on its severity. For patients with mild hemophilia, on-demand treatment is used to stop prolonged bleeding when it occurs. In contrast, patients with moderate to severe hemophilia receive frequent medication to prevent bleeding and other complications such as joint or muscle damage. Factor replacement therapy is the best solution until successful gene therapy can be developed.
Whether hemophiliacs receive factor concentrates every day, several times a month, or almost never, one thing is certain. Factor concentrates are very effective in stopping the bleeding. Even though hemophilia is a complex disorder with potential complications, good quality medical care at hemophilia treatment centers can help prevent serious problems. According to the Canadian Hemophiliac Society, preventative or prophylaxis therapy gives children the best chance to reach adulthood without damage to their joints. World Hemophilia Day is on April 17th and is to educate people about inherited bleeding diseases.